Healthcare, sadly, has become the number one driver of poverty, homelessness, and bankruptcy.
You've got people trying to make decisions between buying health care or groceries.
2 out of 3 American working people are denying themselves of care because of the out-of-pocket costs. Farmers, the truck drivers, the manufacturers, the distributors, the county governments, the school districts, they're the ones suffering the most.
It's shameful.
The people prescribing healthcare don't understand what it costs, and employers don't think that there's anything that they can do about it.
All the solutions to fix healthcare have already been invented, they've been proven, and they've been replicated. Number one, the government needs to make sure that the law on hospital pricing transparency is enforced.
A transparent, better care, lower cost, more control health plan. That's what we're doing.
I mean providers that are unafraid to be judged on quality, and they're unafraid to post fair, reasonable price up front. And so we've built health plans that incentivize members to go to those types of providers by completely waiving any out-of-pocket. So now we can get members to a $700 MRI instead of a $7,000 MRI, and the employer pays 100% of $700 instead of 50% of $7,000.
We can get people as healthy as possible, as quickly as possible, by getting them to the highest quality healthcare providers and getting the best care. Cost reduction is the natural consequence. The high quality doctors, the ones who do it very well, that have low infection rates, that have low readmission rates, they actually cost less.
I was recruited by the state of Montana to take over the state employee health plan with the sole goal of turning it around financially. Saved $121 million, and how we did it was putting in the reference-based pricing contracts from the hospitals, changing the pharmacy benefit. We enhanced primary care. We managed it, and they got pay raises. We didn't need any legislation to do what we did. We just went out and contracted with the right parties. There's nothing to stop any public employee health plan from doing this.
Ashtabula Area City Schools is the 8th poorest school district in the state of Ohio, and union leaders started to nod their head and say, yes, absolutely. We want better benefits and, zero deductibles, zero coinsurance. The plan got better, a direct primary care doctor, a community pharmacy. We took back healthcare, over $2.4 million in savings in the very first year.
Our first year in, we saved $780,000. $780,000 in Barberville, Kentucky, that's the equivalent of another small town within the town.
We saved the district and its employees. 2021 was $2.5 million. And somebody in the audience said, we closed a school this year. That $1.5 million would have kept that school in our district open.
If we hadn't done anything and stayed on the same projection, it would be about $21 million.
Have a large Taft-Hartley firm that we actually saved $31 million in 1 year.
So the city of Milwaukee was able to save $37 million in 1 year. They were able to avoid layoffs as well as lower the deductibles and copays from $4,000 per family to $0 per family.
We reduced their cost of prescription drugs by over $10 million. I've got the data, I've got the examples. Show me where I'm wrong.
Our direct contracts are so significantly lower than the status quo BUCA plans. It enables the plan to offer all of these care benefits at zero out of pocket to working people. Generics for zero out of pocket, surgeries for zero out of pocket, imaging for zero out of pocket.
We're able to take that money and redeploy it within the company, whether it's more benefits, more 401k, more wages, less money out of their paycheck, less money out of their pocket, enhanced mental health benefits, enhanced physical therapy benefits.
We've put more than $5,000 per employee back in their pocket that is reinvested into retirement or into their take-home pay for the betterment and quality of life. And that has resulted in extremely high retention rates.
This model works everywhere.
The union was phenomenal. We couldn't have done it without them. They became the biggest advocates. They wrote opinion pieces in newspapers.
The unions, they love it because they can add real take-home value to their members. And then the community loves it because they're not being asked to dig into their pocket one more time to pay more in taxes.
Every employer did what the employers we're working with did. That would be like a $500 billion recurring stimulus every year.
In the inflationary market that we're in today, I can't think of a better way to offset that than taking any entity's second or third biggest line item and cutting it in half.
Healthcare can be done affordably for the working middle class.
America already has the solution We just need to scale it.
This system is fixable.
Live from New York, it's Benefits with Friends. I'm your host, Lou Bernardi. This is season 2, episode 1, and we thank you for your patience. I know that was a 5-minute intro video, but it's a powerful video done in conjunction with a gentleman that I'm going to bring on to the show very shortly, Dave Chase from the Health Rosetta, and it's a video that people need to see. This needs to spread. We have a big problem in the United States, and my mission, part of my mission is to be part of the solution here from my desk in Woodbury, New York. So I'm not going to make Dave wait in the sidelines. He's too important to this community. Dave, welcome to Benefits with Friends.
Hey, thanks for having me, Lou. Looking forward to the chat.
I appreciate it. The first time I saw that video, I got goosebumps. I mean, it was just so well done, and it really just brings so many different messages together. And I'm a long-winded New Yorker, so when I get into conversations with people, they can go hours sometimes. And I think if you just listen to the message, employers, the American healthcare consumer, which I want to get into because we exchanged some emails, and we're involved in so many of the same types of things, and you at maybe on a different side and at a different level, and with all of those superstars in that video, just really incredible. Your production team is a lot better than than mine because you're looking at them. So, but anyway, if you want to introduce yourself, maybe a little bit of your background of who's Dave Chase.
Sure. Yeah, I mean, my background. Well, I'm the co-founder of Health Rosetta, and my background was really on the health technology side. It's only in the last, decade or so, and really we officially launched Health Rosetta 5 years ago, started working on it in earnest about 7 years ago. And it was really, there was a longer personal story I'm happy to get into if you wanted to, about what really fired me up to tackle this problem and just ask a lot of questions.
Mm-hmm.
But the bottom line was that the root cause of so many areas of dysfunction in healthcare were in this area. So I'm just a curious guy, asked lots of questions, and that's what drew me to this area. Back in the day, I started my career in a big consulting firm called Accenture, putting in health IT systems in hospitals, and then started Microsoft's healthcare business. Fast forward, the last thing I did before Health Rosetta was I had a company called Avado that ultimately WebMD acquired, and it was really around patient engagement. And an oversimplification would be, think of it like HIPAA compliant Gmail in a way.
Mm-hmm.
So, been around the tech side of it, but really in the last several years got into where I think is the biggest lever in the entire industry, employee health plans.
Yeah, no, I think the number is approximately 80% of all Americans that are insured in this country have it through their employer, right? And it's been that way for quite a long time. And I think, this is my 30th year selling insurance, right? So I guess I did that for 25 years. I don't feel like I sell insurance anymore, and that's something I'll get into in a second, because the entire focus is on insurance, right? And has been for way too long. But really, the focus needs to be on the healthcare. When you say patient engagement, that's something that's, it's easy to say, but it's lacking in so many ways, right? The patients really aren't engaged, and I think it's because they can't be engaged. There's no useful information for them to make informed, engaged decisions. And I think for me, that's what Health Rosetta has become. So I saw a video of yours this week as I was going through. I was like, I want to introduce Dave in the proper way. And I saw a video from November of 2016. And it was so funny because that's when I decided to leave the GA world. I was a broker's broker for 25 years, but something was off, something was lacking, and I didn't really know what it was at that time. In January 2017, I left to focus exclusively on my own agency, and I wasn't sure what my prospect looked like. And that's kind of what set me on this path. And as I sat there, really starting to question things like medical trend, and starting to wonder, we have these behemoth companies in the U.S., the BUCAs. Is that Pat in the video? I think, is it Pat, that the slide that says BUCA?
Yep. Yeah.
Yeah,
Patrick
yeah.
Long called them out. Yeah.
And if they're so enormous and they have so much leverage, why are the prices going up 5-10% every year? Didn't make any sense to me. And that's actually how I happened upon the Health Rosetta, I guess, connecting through other advisors, through LinkedIn. And I said, wow, there's other people that are thinking like me. And when you started Health Rosetta, did you imagine, was it a world that brokers would be attracted to? Like what did you envision in the very beginning?
Yeah, I mean, definitely brokers, people call them benefit brokers, benefit consultants, benefit advisors. Um, as I dug in, I realized I actually wrote a piece, I think 7 years ago in Forbes entitled "This Job Could Save America," talking about that role. And, at their best, literally can save the American dream. And, lots of good people in the industry, even in the most vilified corners of the industry, candidly, they went into it for the right reasons, but there's a lot of perverse incentives. And so in the status quo, the cold, hard reality is employee health plans for the last 20, 30 years have become the number one driver of inflation, debt, poverty, and bankruptcy. That's a really sad statement. And it's a very avoidable thing, but you have to relook at what's going on. And that was really the thing that through this journey, I was finding, dysfunction upon dysfunction and going, wow, other than these great clinicians we have, there's virtually nothing to save about this system. It has to do a reset. That's always the way things work.
Right.
What's going to replace that? And then I, through that, starting with the Avado experience, I found these organizations that were reinventing healthcare delivery. And boy, it was incredible. By comparison, it was utopia. And I just kind of joked, with my friends, like, this is just a marketing problem. Like, everybody would want this. And it turns out there's a better way. Number one, it's easier than they think. Not easy, but easier than you think. And today versus several years ago when we got started, we now have successes in every corner of the country and virtually every industry and large and small organizations, public and private sector. And that's the real gratifying thing is it's been doable. It was a bet, right? That TED Talk you were referring to was entitled, I think, "Healthcare Stole the American Dream. Here's how we take it back." Well, we can't do that on our own. We need a lot of people like you making it happen on the ground. If that doesn't happen, I'm just some idiot yelling at the internet, right? I need to have people make it happen.
Well, it's funny because, you think you have the next best thing, right? And you think what the consumer is looking for. Because if people knew, you know what? I'll back up for 1 second because, just if we're talking to HR, I call them benefit decision makers, right? HR directors, chief of people, CEOs, CFOs. The more people involved, I think, the better at a company. And one of the things that I've come to realize throughout my 30-year career is at some point, the financial minds of businesses stepped out of the room. They no longer came to the benefit renewals. They were involved in every one, but whether it be deliberate or an accident, managed care hit all the numbers. there's nothing to crunch. The entire focus was on insurance. And I think the average person just thinks we can't do anything about it. It just goes up every single year. So the best that we can hope for is to mitigate the damage, right? You and I both know a lot more can be done with that, because when you do have the numbers, when you do get the data, the actionable data, you can see that the claims are not just the claims. There is so much artificial cost, hidden profits. I mean, it's just amazing what's allowed to be done. But unless the consumer does become engaged, and we talk about consumer. For me, and you and I had an exchange of emails last week on this, because for me, there's multiple consumers in this. I think the one that you kind of focus on most when you think about it is the employer, because they're making the benefit decisions for their entire organization and all of the people there. But they're a consumer. But they're consuming insurance. We have to take that focus and make them understand you're not consuming insurance. You're buying insurance, but you're consuming healthcare for your employees. You're financing it with the insurance. We have to make them think of themselves differently. If they were buying office supplies and they realized that they were buying $100 desks and paying $1,000 for it, they would fire their supplier in a second, in a heartbeat. Yeah. Why are they paying, as Dave Contorno mentioned in the video, why are they paying $3,500 for a $600 MRI, right? Mm-hmm. If they knew that, they'd be like, oh, what else am I paying? The C-suite would get re-engaged in the conversation. That's a crucial part. And then you have the employees that are consumers when they're opting and making a decision on which plan am I going to take. Most of our clients offer multiple plan options, maybe not all of them, but a lot of them do. And that employee, unfortunately, is making an uninformed decision. And too often they're buying the least expensive plan, and they find out 6 months later, oops, this is going to cost me what to have a baby? And then, of course, they're a consumer when they enter the healthcare system. And then they're at the mercy of I call them a very predatory healthcare system. So consumer for me is kind of threefold. We need to get through to the HR people, because that's where we can make that footprint just expands. We can't go to employees and ask them to change anything. We have to get to the employers and get them to think about that initial purchase, differently. I don't know if you have any thoughts about that.
Yeah, I mean, a big picture, really what we're doing is just asking people to do what they do with everything else that they spend money on. They don't, shut off their brain when they're buying desks or, finding office space, and sort of just throw in the white flag, or throw in the towel or raise the white flag. Yeah. And so that's the type of thing where one of the things people don't really recognize when it comes to paying money for healthcare coverage is basically 20% roughly of the spend, sometimes less, is actual insurance. That's particularly with larger, that's a stop loss insurance. These are the random events that are pretty unpredictable. Mm-hmm. Though you can do some things about those, by the way. 80%, over enough lives is pretty darn budgetable, right? There's going to be a certain number of MRIs, primary care visits. These are things that can be budgeted. You can be smart in your procurement in that way, and you can step into it, right? That's one of the key things that we really guide people towards is this 5-step process. The first step is just a mindset shift that you actually can solve this problem.
Yeah.
And 4 of the 5 steps are invisible to the member or only clearly a huge positive. And so you don't have to get into, and the last step is the one that has the biggest payoff and in the hands of a professional, isn't disruptive, but you have to be very thoughtful about it. And so, maybe don't start there, cut your teeth and the good news in air quotes is the shenanigans are so extreme in things like PBM contracts that there's lots of opportunity to save before you even change where people pick up their medications or the formulary.
Right.
And that's the most common interface people have with the healthcare system is their pharmacy. So the problem is we have found that when you look at the mid-market where we have our biggest focus, the 50 to 5,000 employee market, it would be charitable to say that 95% of them don't look at the agreements, that they look at them the way probably you or I look at a terms of service on some consumer website, like check, I agree. In actuality, it's probably more like 98% don't look at them. But let's just call it 95%, and let's just pick a company in the middle of that size range. Let's to use round numbers, an employer of 1,000 employees, so they're spending, we'll call it $10 million on health benefits. Never in a million years would that company do a $10 million acquisition and never look at the M&A agreement. Like that would be unfathomable, but that's basically what they're doing when it comes to a health plan. And that's probably been the biggest single aha for us, is that you have to sweat those contract details. You sometimes hear about the waste in healthcare, like PwC and National Academy of Medicine. If you pick kind of a midpoint, $1.5 trillion with a T is wasted every year in the U.S. healthcare system. That would be the 11th largest economy in the world, bigger than Russia is what we waste. That's not an accident. That's all codified in those agreements that most employers aren't even looking at. And so that's why that's been one of our biggest investments in Health Rosetta after our people. It's probably our biggest investment is these really expensive but awesome attorneys. And because we have a whole community of folks, we can sort of amortize that investment across that. That's why the worst result that we've seen when we're directly involved with a plan is a 20% absolute reduction in spend, with benefits typically getting better, like removing cost sharing, adding proper primary care and stuff like that. So you got to sweat those details. Most aren't. And so that's an important place to start.
Yeah. When I think about, when I started down this path, it became very clear that self-insuring with independent TPAs, third-party administrators, that essentially replace what the fundamental role of the insurance carriers are, right? They're paying the claims, they're issuing ID cards, they're pulling in all of the different pieces. But now you have the ability, because of that new relationship, to bring in the best of the best. The case management companies like Nurse Deb, from the video, that have a real alignment with the employer, not an alignment with the insurance carriers, that are picking the partnerships that suit their best interest, right? And that best interest is almost always a financial best interest. They package it and make it so easy to buy, and then they hide all the details, right? It's in the consumer's best interest not to have access to the data, right? And we fight every day.
Yeah, I mean, that's the thing that's been really gratifying here, is if you do the right thing and say, we're going to focus in on healthcare quality and get people to high value surgeons and doctors and pharmacists and all that. And unfortunately, going back to those contracts and the point you just made, in those contracts, that the carriers, their real customer in many ways are the big health systems that they work with. And that's a whole other longer discussion, but that's really their primary concern, is those organizations, despite what you may think. And they prevent you in these contracts, in standard plans, from guiding a member. So somebody like Deb and her team in these status quo plans would be contractually prohibited from getting you to the best surgeon at the best facility that doesn't overtreat. That really matters. And the nice thing is, if you focus in on that quality, you get the cost savings for free, and that is powerful. And that's the nice win. And we really put everything we do it a big picture through this filter of what's called the quadruple aim.
Mm-hmm.
Improve the caregiver experience. That naturally leads to a better patient experience. That's kind of when the magic happens, whereas that partnership, that
Right.
patient engagement we're talking about, when that happens, that naturally leads to the best health outcomes. And if you're in a good model, that leads to lower costs. So better caregiver experience, better patient experience, better outcomes, lower costs. That's a quadruple aim. That's a good filter. And the thing that's kind of interesting is we try to focus in on just the positive, like, hey, here is this much better world you can move into. And some people will ask me about this or that big incumbent organization from the status quo. And what I'll say is they're weirdly irrelevant if you're focused in the quadruple aim. They have decades of evidence of basically missing that target. If you're supposed to aim at the quadruple aim, they're wildly missing that target. So we're not about bashing them. They're just not useful for us. And fortunately, we have the best clinicians in the world, and they're passionate. We just need to let doctors be doctors, nurses be not nurses, and not turn them into glorified billing clerks.
Yeah, I know one of the stats I saw is that the U.S. is literally in last place in 8 of the 10, important factors, of healthcare. Right, our system is behind every other, well, I'm not, the word's not popping into my head, but let's just say first world countries, right? With
developed countries, or
and it's not
whatever,
because we don't have the capability. It's because of the system. It's because their hands are being tied. Doctors are not bad people. We have some of the best doctors in the world. Nurses. My wife is a nurse. She was a NICU nurse for many years. They can do unbelievable things. It's the system that ties their hands, takes the control out of their hands. And that's just not acceptable, right? I mean, if this was a sports team, we're paying 10 times more to underperform.
Mm-hmm.
Right. And it's the people in charge. I'm writing my first book. I think you're on your 5th or 6th or 7th, or it's not easy. I got to hand it to you. It's a big undertaking. And it just, as you're writing it, I was getting things out, and it just became just so abundantly clear to me that the healthcare systems, not the providers of healthcare, the systems, the people in the boardrooms making the big decisions, that impact the financial, goals of that organization. And the same thing on the health insurance side. I talked to, my 30 years in the business, I know a lot of insurance carrier reps. They have no idea what's going on. And that's purposeful, because a lot of them could not go back to work tomorrow if they understood that the Buca company that they're working for, how they're contributing to this just complete, unbelievably, unmoral, stealing of the American dream, like you mentioned.
We have amazing clinicians, and I often remind people, hospitals don't save lives. Nurses and doctors, with the help sometimes of medical devices or medications, save lives.
Right.
And that's really important to remember. And I'll tell you, there are 2 things that we're the undisputed world leaders in healthcare. We are the undisputed world leaders in preventable medical mistake death, and serious complications as well. There's 10,000 serious preventable medical complications a day, not because we have bad clinicians, but we have bad systems and bad cultures and understaffing. And the second thing that we're the undisputed world leaders in, even while we're spending twice what the next closest country is spending, is medical bill driven bankruptcy. So we're absolutely number 1 in those things. But as you said, we're near or at the bottom of the heap of developed countries on most quality things. And that's an incredible waste of talent given, I mean, people like your wife, right? The smartest, most passionate, gratification delaying people that I grew up with often became nurses and doctors, right? And in many ways, they're the biggest victims because they live it every day. Most of us don't have to live in the healthcare system. Even before COVID, there was record levels of um, uh, burnout and suicide. And really the term that is being used replacing burnout is moral injury. And that's this notion of because burnout kind of blames the victim, whereas moral injury is when somebody is in an organization and they're being forced to do something that is at odds with their morals. That is what leads to some depression and worse in some cases. So tragic situation, entirely fixable. And we have so many case studies, right? That the production company that shot that video we had at the start, they did one of a union in your area that covers like the people involved in operating a building, the doormen, the custodians, and so on. And just as one data point, or I'll give you a couple data points. One was they removed one of these price gouging hospitals, low value, that's not pulling their fair share, given they've got these massive tax breaks. And removing that one health system for 1 year, they saved $32 million for their members. That allowed them to do a one-time unprecedented bonus to these working class individuals of $3,000 and the largest raise in memory. And it was good for the building owners too. They had the lowest premium increase they'd had in basically ever. And to give you an idea of like an example of what that means for a member, let's say you're pregnant. That is, of course, a joyous event in most situations, right? But for a lot of people, that's a real financial hardship. Well, for these folks, their all-in cost for all the prenatal care, labor and delivery, you name it, $40, 40. That's what's possible, right?
Yeah.
When you have high value plans. And what a difference maker for these people. Like they can focus in on the joy of having a new child rather than worrying about, some $20,000 bill.
Here in New York, where we have community rating. So for small employers, which aren't really very small, employers with 100 or fewer full-time equivalent employees fall into the New York community rated market. So those are all fully insured plans. You're not allowed to do stop loss. You're not allowed to do self-insurance. And, a lot of, I would say the most comprehensive solution is self-insurance with an independent TPA, independent PBM, case management, direct contracting, direct primary care. I love. There's one in Long Island. My daughter, who's on the other side of that door, works with me, is signed up for her. It's amazing, but it's, some of the solutions differ. Health Rosetta is not a stamp. This is what we do. This is how we do it. These are the companies. So as I was going on this journey, and I said, and we call the benefits with friends, but it's how to awaken the American healthcare consumer. That's what I want to do, right? And 2-person companies, 3-person companies, 5-person companies, they're still people. That's what they have in common with the 1,000-person group. It's just people, and I love helping people. So fundamentally, I can't change where they're shopping for insurance. We can do things like PEOs, things like that, but for me, it starts with it's inexcusable that in this country, with the technology that we have, that someone has to do a Google search to find a doctor. And the type of results, and I think it's 70% of all Google searches are looking for medical practitioner, something insane like that. And what you're going to get is very clean office, very friendly staff. Doctor had great bedside manner, but you're not getting the important details on how good this doctor is, how well do they perform the particular surgery? Are they a orthopedist that specializes on elbows, knees, shoulders, backs? Are they a good cardiologist? What type of cases do they take? Do they prescribe opioids? Do they pull people in out of the parking lot and they do 2,000 surgeries? But is that appropriate? That's to me fundamentally what's lacking. The insurance and the way to do the insurance is a little bit of a puzzle because it's different for every single one of our clients. You don't have to self-insure to make an impact, to save, because even a fully insured group, at the heart of it, and a lot of HR people and benefit decision makers don't understand this. Your premium is based on the amount of health care and prescriptions your employees consume. So if we can lower that, if we can lower the expected cost of insuring those people, your insurance costs, whether you're fully insured or self-insured, is going to go down. You're going to be a more attractive potential client. You're going to have a lot more options. So that, we talk about that a lot, and you hit it right on the head. When we broke it down and we're working with all these different companies to try to figure identity, like what is the big problem? The biggest problem is mindset. The mindset, and I realized recently, the American healthcare consumer, both patient, employee, and employer, have been groomed by managed care for the past 25 years. They have been groomed to get to the point we are now, so that we just completely, like you mentioned, we raised the white flag. That's the biggest obstacle. Where there's a will, there's a way. If you have the will, and I think a lot of people, a lot of employers, they just don't have the will anymore. They're defeated. 20 years of paying more and getting less has taken people from a $5 copay in the early 90s on an HMO contract to a 17,000 plus family out of pocket, and in some cases deductible. You don't have you have no coverage until you've spent $17,000 out of your pocket. Thank you very much, and send us $2,000 a month in premium. I mean, if that doesn't sum up the problem that we have from an insurance standpoint, I don't know what else does. So, benefit strategies and resources, part of the Health Rosetta, for people who aren't familiar with it, and, if they're not listening now, hopefully they'll listen in the future. Health Rosetta to me is just an ecosystem of people who one day saw something like myself and could not go back to doing business the same way. It's a lot easier. I'm sure you hear this from the advisors, consultants. I'm the BOO. I don't know if you know what BOO stands for. Benefit Optimization Officer. I don't want to be a broker. Brokers sell insurance products. Businesses need someone internally, because HR simply do not have the time to spend on this. And unless we can re-engage the C-suite, we can't expect them to get back into the game. And that's really what they need to do. It needs to be a team approach. You need to either elevate the HR into that senior role, give them a seat at the table, or someone from the table's got to come down to HR and be at that level and say, what is going on here? Like GE did many years ago. I forget the gentleman's name. I met him in New York City one day, where I guess he famously said that GE spent more money on healthcare than on steel. And he didn't know why.
I know it's amazing. And I'll tell you, there's two things that I enjoy more than anything else in what you spoke. One of them, some of what you're talking about really spoke to this, which is, once you see this, you can't unsee it. But here's the really cool thing. It's people like you, people like Tina Wilt, people like Bryce Heinbaugh that are in our program, where good people were trying to do the right thing. And, it was tough, right? Every year, even if you're making decent money, it sucks to have to go out and deliver, hey, great news, guys, pay more, get less, and then obfuscate the increases through, cost shifting onto the backs of people least able to afford it. And then when they go from that to this world, the light comes back in their eyes and they make that transition that I talk about sometimes of, generally as an adult, it's better to have a job than not have a job. But once you have some competence, it's better to have a career than a job, but much better than a career is a calling. They, the old, I think Mark Twain, 2 most important days of your life: day you're born and day you figure out why. And when those people figure out why and they're unleashed, it's incredible. Yes, it's hard work, but I don't know about you. I've never seen anything great in life that wasn't a ton of work, whether it was, somebody getting into med school or, as a competitive athlete, we worked hard and, had lots of, dirt and mud in our face and teeth and all that. But wow, so rewarding. And same thing here. You can make the easy money doing the other way, but that's the reason people have midlife crises. And that's why people have willful ignorance sometimes, because they kind of know something's not quite right. And that doesn't feel good. That's not who people want to look at the mirror and see. And so when they make that transformation, that's a game changer. And then, to give you the other thing that really lights me up, then they can do the things for members. Like I mentioned, the $40 pregnancy and being able to afford medications that somebody couldn't afford before, or they had to use all their disposable income so they could never even take a vacation. I love those stories. I love when people like you, who are actually on the ground working with specific employers and employees, tell me those stories, because it's hard work. We get kicked in the teeth every day. But it's easy to keep coming back for more when you see people's career get reinvigorated, and then the members' human impact is beyond belief. It's not like we got to wait 10 years for the payoff. It's pretty much immediate.
Yeah, I say all the time that, it took me 30 years to get 5 years experience because I was the expert. That's what scared me. And I felt, wow, I was a pawn. We're all playing checkers, but we're on a chessboard.
Yeah.
And that's really part of the problem. And, once I had my aha moment and I knew immediately, wow, I'm not going to be the same. I felt it and immediately, because I had a flashback. We're starting to do open enrollment in person again, which is great. I just got back from Miami and it was amazing with the new client. And there hasn't been enough of that interaction with people. But, for many, many years, I would do, 100 a year, let's just say. And at the end of the meeting, I always tell the members, I'm going to stick around because you may have a personal question that you don't feel comfortable to ask in front of your coworkers. And inevitably, there's always 1 or 2 people that would come up. And way too many times, people would break down and cry because we raised the copay on a prescription by $20, which doesn't sound like a lot. And it's not a lot to a lot of people. But for many people, it is. And that person, and I get choked up a little bit, because when someone tells you, I have 7 prescriptions and I'm already taking only 5 of them, and I'm going to have to give up another one. And then you understand what I came to understand, that all of the prices and all of the hidden profits are just manipulating things. It doesn't matter what you do to the plan. They're just going to raise the price. They're going to hide it in another spot. So that's what, started us on these journeys. So we don't have to have those hard conversations quite as often anymore. But here's what happened when we did change it. And, this one was really impactful to me because, as you know, most people just follow the plan where the doctor sends them. They don't ask questions. They don't have access to the price beforehand. And we had a gentleman on a plan that we had repurposed into the independent partnerships. And I got an email. This was the very first one. And we never get emails like this before, but now we were, because of where we had placed this account. And the TPA emailed me, and 10 minutes later, I got an email from a specialty, a pharmacy supplier that we're working with, and said, hey, Lou, boom, we just got pre-certification notes through the network. We're still using a network. We haven't gone reference-based pricing yet. So, we see that a pre-certification of an injectable medication just came through. It's $115,000 for this injection twice a year. Okay. We can do it for $30,000 twice per year. So $60,000 instead of $230,000. That's great. To me, that's important. I mean, that's a lot of money. But what I immediately went to is, wow, if this was the old way, and the reason why they were bringing it to my attention is we want to get in touch with that member. We're going to do outreach to that member, let them know that we exist, because people aren't used to their insurance carriers calling them and saying, hey, we have an option for you. So here's your option. You can go where you were going to go. Absolutely. We're not going to force this on you, but it's going to cost you $7,500 out of your pocket, because it's an injectable medication in a doctor setting. So it's a medical claim, and the plan year just started and you haven't met your deductible or coinsurance yet. So it'll be $7,500, or we can send someone to your home because it's medically appropriate. We can do it. All of the guidelines say, and it costs you zero. And this young man in his late 20s, father of two, no spouse in the picture. I don't know the story there, but he's on disability. He's about to come back to work. And immediately at the human level, what I realized we just did is, the old way, he goes to the doctor's office, he gets the shot. 3 to 4 weeks later, he gets a bill and he gets an EOB, and it says he owes $7,500. And in those 3 to 4 weeks, my worst nightmare is that his quality of life goes through the roof. He feels better. He's a better dad. He's back to work. He's skipping and jumping, and he never gets the shot again. And that's the reality for a lot of people. They find out afterwards. We don't want that to happen. We want them to know their choices ahead of time. So net, we save the employer $90,000 a year, because the $115,000 was probably going to, estimates were the carrier would have paid $80,000 each time. So 160, we procured it for $60,000 all in. That's with the that's with the administering of it in the home and all of that stuff. So the employer's thrilled. But more important to me, that young man gets to have the shot for zero for as long as he's an employer of this company, and it's the choice of going on vacation with his family. Maybe he continues the shot, gets a second job somehow, and can't go on vacation. I mean, my mind just spins at the human level, all the possibilities that this unleashes on everybody. And this is being done under the Health Rosetta model with all of the advisors. How many advisors are there now?
A little over 200.
A little over 200. Yeah. I think I was in the third cohort. And
Sounds right.
Yeah.
And collectively, you all steward about 5 million lives.
Wow. It's amazing.
Yeah.
And it's not enough. It's not enough. I could tell you this, and I don't talk to you enough, that I probably have 2 or 3 conversations a month with advisors that ask me, can I talk to you about Health Rosetta? They get a little intimidated because they think, wow, it isn't just signing up, right? You have to go through
no mail-in diploma, right? That's what some people want. Yeah.
There's a vetting process, right? I mean, you want to make sure that people aren't walking around with this, let's just call label, right? Health Rosetta label, and they don't have their heart in the right place, right? They're not looking to make the impact.
And that's actually the biggest criteria, right? We have a bunch of career switchers who knew basically zero, other than having received benefits, but they had passion and will. And so we're fine with, and there's plenty of folks who, had been doing things the old way that wanted to reinvent themselves. And, they're obviously not going to have the most successfully just jump into the deep end and do the most extreme thing. They can step into it, and we want to meet everybody where they're at in that journey. But yeah, we're going to try to filter for, we call the giver and doer mindset, this mantra, give 1, get 10. And I think that's one of the things that's been really powerful is, and I'm sure you've experienced it, where in a lot of the industry, there's this sort of scarcity mindset, and people keep their little secret, list of vendors or information. And here it's the opposite. People know this is tough. They are going to need help from others. They ask for help. They have this great brain trust. Even if they're super savvy, there's always new challenges that come along. And so having that, and then they're doers, right? You could go to industry events for at least a decade where people would talk a good game, and you say, okay, where's the beef? Where are the results? No, it's a great PowerPoint. No, like we want people to actually produce the results. I mean, one of the things we delivered recently is 5 years since the official launch. We've basically been marinating internally on this thing we call a plan grader that was used to through the initial joining of the program and then renewals. And now we're very confident we know the 40 most important factors that drive a high performance health plan. And so even if you don't have a great grade as an individual plan, it gives you a benchmark of where you're at, and then start chipping away, right? You can be in the most improved, candidate pool. And that's fine, right? We all had our aha moments. It's not like people were born with this knowledge. So, whether it's the employer, whether it's the broker, advisor, consultant, as long as they've got their heart in the right place and want to walk the talk, we'd love to collaborate with them.
Well, that has been, I could tell you from personally, that was when I stumbled across it, and it had to be LinkedIn probably. When I stumbled across the conversations that I've been thinking to myself, and I thought that, I'm a pink elephant. I must be the only one that's really thinking this. And I got involved, and I started having conversations with those, amazing, women and men in benefits. I felt like for the first time, and I've been in this industry for 30 years, I never had a community. I didn't have friends in the industry. I can call out, 20 names right now that I can get on the phone in 5 minutes or email or text. And it just helps to multiply the knowledge by just, immense help for me, for my clients. I think that the most important thing, that kind of the takeaway as we kind of wrap it up now for an HR benefit decision maker, is that I always say the conversation is complex. The solutions are simple. You have to understand that there's a problem. If you don't think there's a problem, then you're not going to fix it, right? You can't fix a problem, but everybody has the problem. I mean, I think we know that there's not any BUCA type programs that don't hide profits and artificially inflate all of the prices. But that's besides the point. There's plenty of people that know they have a problem. They're intimidated by the prospect of changing it, right? They believe nothing can be done. And, we've seen it firsthand. I know that you and the hundreds of brokers that you or advisors that you speak with, they're all doing it. 5 million lives is a little scratch, right? We need to make a dent next and make a real impact. But I think we are making an impact because I have a pretty good pulse on the language that the carriers are choosing to use and the different ventures that they're getting into, because they understand, I think, that certain profit centers are going to dry up because the consumer is getting smarter. More and more advisors are going to go down this path. They're inventing new ones, right? There's always going to be this problem to solve. They are not just going to say, "Oh, shucks," and give up 20% of their stock price. They're not going to do that very easily. But if the consumer wakes up and takes their business elsewhere, they must react. And that, to me, is kind of the purpose of this show, is to awaken the American healthcare consumer. That's the employer. We want to make individuals smarter consumers of insurance products, and also smarter consumers once they enter that healthcare system, know where to go, know how to look, know that they have rights. They don't have to go where their doctor sends them down the hall for that MRI, because that net is being cast larger and larger every day. The healthcare systems own every component of it, and they're trying to let the fewest patients escape. right? They want that member when that member is good to go. And we're just trying to help people understand that they have options. So anything you want to say, kind of as takeaway, if you were talking to an employer today, other than definitely go to healthrosetta.org.
Yep.
You can find the advisors on there. That's a one key place I would say to start. They're all over the country. If you're connected with me on LinkedIn, obviously you could reach out to me. But if it's in Texas or Florida or Ohio or North Carolina or Seattle or anywhere, there is a Health Rosetta advisor out there that's more than happy, I'm sure, to speak with you, share their thoughts, and and start there.
Yeah. Yeah. I mean, just go back to there's a better way. It's easier than you think. And there's successes for organizations like yours. And we can help you make that happen. And something as important as a health plan, that plan grader I mentioned, you can think of that like as a second opinion. If you had a serious condition like a cancer, you'd want a second opinion. Go to somebody like Lou and ask for that second opinion, and you can kind of get a sense of where you're at, so you know where you need to go.
Yeah, it's a very different conversation, I can promise you, that they'll have with an advisor that's really on this track. And that's one of the things, sometimes I have conversations, and on the other side of the desk, you get that deer in the headlight moment.
Mm-hmm.
And you have to wonder, did I lose them? Or did I just get them into such deep thought that they're not going to be able to go back to doing it the same way again? And sometimes it takes 2 or 3 years. Some of our recent successes, we started 3 years ago. And I knew we were planting a seed at that moment. And that another 2 years of the status quo, pay more, get less, eventually was going to resonate with that decision maker. And they were going to say, you know what? He was right. In 7 years, it's going to double. If we don't think we have a problem now, do we have a problem when our insurance costs double in 7 years? Well, you better start addressing that now, because if you wait till then, it's too late. So I want to thank you so much. I hope to.
For sure. It's been great chatting.
Yeah, you too. Enjoy. I will talk to you soon.
Okay. Take care. Bye-bye.
Take care. Bye-bye.